Tonight, dental professionals are warning of the harmful impact of removing fluoride from water and what it could do to communities.
This is after U.S. Health Secretary Robert F. Kennedy Jr. spoke about his controversial plan to stop recommending fluoride in drinking water across the country. Utah recently became the first state to ban fluoride in its water system, with Kennedy hoping more states will soon follow suit.
But those in the dentistry field are pushing for the exact opposite. Tonight, News Channel 3's Mackenzie Decker joining us live in studio with more on their concerns. Mackenzie.
Yeah, Andy, Jessica, this is an issue with a long history dating all the way back to the 1940s when Grand Rapids became the first city in the world to fluoridate its drinking water. And it's been part of the community ever since. Now, 80 years later, one dentist I spoke to is hoping that doesn't change. Christopher Smiley has been a dentist in Grand Rapids for nearly 40 years, now concerned for the future of fluoride.
We're going to see great increase in decay, and it's totally unnecessary.
Smiley voicing his opposition in response to U.S. Health Secretary Robert F. Kennedy Jr. telling the CDC to stop recommending fluoride in drinking water nationwide.
Now we know that there is no systemic advantage, zero systemic advantage, and that the only advantage comes from topical application.
Kennedy taking to X back in November, saying fluoride is an industrial waste associated with arthritis, bone breaks, and thyroid disease. The U.S. Environmental Protection Agency, which sets the maximum level of fluoride allowed in public water systems, also saying they'll be reviewing new information on potential health effects.
So what EPA is going to do is go back and look at these studies that have come out since July of 2024, and we're prepared to act based on these science.
But Smiley says there are clear benefits to fluoride, currently estimated to reduce dental decay by 20%, even for adults. Adding that it's especially important for people who don't have access to dental care, relying only on benefits of community water fluoridation.
It really is, I think, an inappropriate thing for communities to do, especially ones like we have here in West Michigan who have a long track record of success and safety.
Smiley also referring to a study showing one community that removed fluoride from their water and one that didn't, side by side. Smiley says the impacts on those that no longer had fluoride could be seen within 3 years, with a massive increase in rate of decay, especially for children 3 to 6 years old.
And it was aggressive. These children required care in hospital settings under general anesthesia because the decay was so rampant.
Smiley also said when thinking about a potential future with no fluoridation, he imagines more cavities for children and adults, along with more limited access to care due to an increase in demand. Now, keep in mind, only Utah has banned fluoride in their water so far. Of course, we'll be sure to keep an eye on any developments. Live in studio, Mackenzie Decker, News Channel 3.